I'm with Jane, who's a patient at my practice and has been with us for some time, who is a lady who suffers from mental illness. She also has other health issues around that. And I'm going to show Jane how her healthcare can be improved by using an electronic health record, which gives her good information about her health, the same information she can provide to other providers that look after her, and so her information can be shared and therefore joined up. So this is about joined healthcare, joined up healthcare, using the electronic health record and helping Jane understand the record better, and then show you how this works for all healthcare professionals who will look after her into the future. So Jane, thanks for coming in. Okay. And we registered you for a personally controlled electronic health record some time ago, and we're going to show that record in a moment. What I want to do is do a normal consultation with you, because my system has a lot of information that is the basis of a good electronic health record. So what we're going to do is pull up your name. And in my system, first of all, it gives me some prompts. So there's things in your history that I need to look at and work on. It keeps reminding me.
Yeah.
So they basically tell me about your medications that you need, the fact you've had some investigations over here, and the things that are outstanding in your normal health care. I also have here the list of your past medical problems, which over time has become quite significant, as you know. And when you're unwell, it's hard to remember all of these things in the right order. And then I can look at your medication list. And your medication list includes your medication for your mental illness, schizophrenia, your pain tablets, patches, iron, more pain relief, something for your tummy, because the tummy gets sore because of the tablets you're taking.
Tablets,
your medication for your depressive illness, which also goes with your other illness, and your drugs for your cancer and to make your bones stronger. So I've got a very good list of your medications.
That's right, yep.
And if I go back out of here, a very good list of your past history. We can look at that in detail, and you can see there's quite a lot on there.
Yeah, a lot of
and it's really quite hard to remember that. And when one person is looking after you, it's important for them to know these things.
That's right.
To make sure your care is done in a shared way. So we will create something called a Shared Health Summary, an SHS, which you will have available to you and anybody you give access to your record with. So Jane, you've seen a record there, and you've been through quite a journey recently with your various issues. How many people have you seen going backwards from your recent fracture, backwards through your history?
We've been through the ambulance people, the X-ray people, oncologists, MRI people, pathologists, also my breast surgeon. I've seen breast nurses in the hospital as well, the assistants, and yourself. So there's quite a few.
And that's just for starters, because you've also got people looking after your mental illness, including a psychiatrist and other people as well.
Yeah.
And it's hard for them to... Did they ask you any questions during those visits to hospital?
They do. They usually hope to get information from the other doctors, but they don't always get it. So this is where this will probably come in handy.
Do you find it hard to remember everything every time in the right order? It
does sometimes. If you're not well and if you're in a bit of pain and things like that, it does make your thoughts sometimes a bit muddled. So it's not always easy to remember, especially my long history as well. So
it is a very long journey that you've been on.
Yes,
and quite a difficult journey. So do you think this might help you?
Definitely, yes. In times of having to see your doctor, you're not always at your best, so this would help to bring together a lot of the information, the summary information, and would make my time with the doctor not as long.
We've got a format. You've already got an electronic health record. I can see that because you've got a green button on my system.
Right.
And if I look at your record, and you've given me permission as your GP to look at this, we can have a look at what's on there at the moment. And there's a whole lot of technology that makes sure that I'm who I say I am.
Yeah.
And anybody looking at it has to have the same sort of credentials.
Right, so not just anybody can go in there.
That's exactly right. You can't go on the World Wide Web and look at this.
Okay.
So this is my view of your personally controlled electronic health record. In 2 years, there's 522 bits of documentation that we can see on that. There is your list of medication, and I could go to each one of those and see what they are, and also a list of your pharmaceuticals, the medications that you're using.
Right.
So for instance, if I went into this one here, I could see that you've had a prescription for this medication here, and not only can I see that, I can save it to my system, so that if I act on that information later on, I actually have that written down. Now, I'm going to create a shared health summary for you. What I'm going to do is just print it out for you, so you can just be sure about it. And we'll have another chance to look at this if there's something we don't want to put on to your summary as we go through it. But that's just there for your record.
Thank you.
Okay. So I go to here, and it asks me if I want to create a PCEHR, Personally Controlled Electronic Health Record summary. And we're going to create a shared health summary. What this does, it sucks out the information that we've curated over some time and produce this. This is generally done by your healthcare provider. In our case, the GP. It could be the mental health care nurse if you're in a team care arrangement, or if you're in an Aboriginal community, it could be an Aboriginal health worker. Now, this one tells me that you've got 2 allergies. So we obviously want to keep those there, they're really important.
That's right.
And then we go through your medication list and make sure that we're comfortable that you are taking these medications. Then as we go down here, we've got your past history. There are some things here that are important to remain on there, including your sore tummy from time to time, your depressive illness. This is an old cold. We don't need to leave that. That's unnecessary information. It's noise, really. Schizophrenia is obviously important. These are all unnecessary additional bits of information. So we don't need, with your agreement, you could say, I actually don't want you to put that. You can say, I really don't want you to put depression.
That's
and
right.
I'd say to you, look, depression's important, and it would not be good for you not to tell somebody you are on that.
That's right, yeah.
But if you insisted I could
That's
do
right.
that,
You have that.
and it would stay on my system, and when I referred you to somebody else, it would be there.
They wouldn't
But it wouldn't
see
be
it.
there for anybody else to share and see. But we'll leave them there. You're happy to leave the
Yeah.
schizophrenia and
Yeah.
the depression?
Yeah,
Okay.
very-
And we did discuss you need to have a flu vaccine today before you leave, and you've had your hepatitis B. We then go and say review it to make sure we're happy with that.
Right.
So that then makes sure that the format is correct, and we can see again the same things: your allergies, your medications, as we discussed, the past history, with the most recent one at the bottom. And what we then say is, if you're happy with that, then we can confirm and upload it to your PCEHR. What we've done so far is see what the PCEHR looks like from the provider's point of view. But this is a PCEHR, a personally controlled electronic health record. It's owned by the patient, it's controlled by the patient, they know who can look at it and who can write to it. So I'm now going to show you how that looks from a patient's point of view. We've now come on to the website which you can look at yourself with the login and password that we've made for you. When you come into this window here, you would then go on to the login button.
Right.
This now will ask for the login, which in this case is this one, and then there's a password. So it gives you all the other services that MyGov website covers,
Yep.
including Centrelink and child support and Medicare. But we're going to go into the personally controlled electronic health record system.
Right.
So this is just looking at the patient portal, and it's orange.
Right.
That tells us you're on the patient side, and there are various things that are on here. There's a thing called a health record overview, and there's a whole lot of information that will be underneath that. Then there's clinical documents. We also have a thing here called a medication record. We also have, now this is very important, this is a thing called the personal health notes. The personal health notes allow you to write a note to yourself about what happened today. Only you can see this. This does not get shared by the other providers.
Right, okay. So they're personal notes.
They're personal notes and for you only. Then we go on to personal health summary. This is where you write what you understand your medications to be, what you understand your allergies to be, and this can be seen as a check.
So it'd be briefly my understanding of my health and what
Yes.
medications I'm taking.
Medications and allergies,
Okay.
which hopefully will be similar to what we've worked on
Yes.
over the years, because you
Yeah.
have that
Yeah.
in front of you. Then there's something here called an advanced care directive. This is where people say, look, if I got dementia and I had a heart attack, please look after me, keep me comfortable. But if I ended up that I needed to have a heart transplant, please don't do a heart transplant. Then there's information about your personal details, which of course your name, address and date of birth, etc. The next one, to me, is a very important setting, is the Medicare records, and it shows the list of pharmaceuticals or medications that you've had dispensed for you from Medicare,
Right.
and also the consultations with the various people that you've had. So if you look at this, you've got the medications you've had for your pain, for your clots, pain again, and for your mental illness, your Abilify, and it'll also have your medication for your depression. That's your fluoxetine. And you can scroll down and see a whole lot of those. And then if you go further down the list, these are the people that you see. Now, you probably don't know that this guy here is your pathologist,
Oh, okay.
right? So
yeah.
they're the people who do your pathology tests.
Yeah.
They're actually doctors. This is the person that's done your x-ray.
Mhm.
And as we scroll down here, you'll see your psychiatrist, your breast surgeon, and me, and again, and your psychologist. And it tells you how many times you see the psychologist, because there's a limit of number
Yes.
of psychologists that you
Yeah.
can get
Mhm.
on the Medicare scheme.
That's
So
right.
it's kind of a bit of a tally, and it
Yes.
starts helping you know. And if somebody's wanting to know who else you've seen and you can't remember, you've got a pretty good chance of finding them on this list. The only other thing I just want to discuss with you is what you were asking me about security. What worries you about your security?
Who'd have access to these records, who I'd give access to, and how they would be given access.
Yeah. Okay. So there are certain settings that you can have to this whole system. Number one is you don't have to have a record. But if you have got a record, there's a very good reason for doing it.
Yes.
You want it to be shared by people that you want to be on the system. For that to happen, I as a professional have to have certain credentials to be on there, or any health professional. So you've got the whole list of credentials that secures you from that point of view.
Right.
And also there's an audit trail on here. So each time somebody looks at your record, you can see that on your audit trail. So over here, if I go into your notification settings, you can see on your record who's actually looked at your records. You can put on there notifications which says, if somebody looks at my record, please send me a text. Then you've got access to the record. Now, you can say any health professional is on the system and looking at it, I don't mind. Or you can say, no, I don't want anybody to do it unless I give them a code. And you can set up a 4-digit code,
Like a password.
like a PIN for the bank, and say only when they give this to the professional and they put it in, can they look at it.
What happens if someone was to have a psychosis, for example, and there was an emergency and they weren't able to give permission to look at our records? What would happen then?
You can do what's called break glass.
Okay.
And when you log in as a professional, you tick a box, and that breaks the glass, and we can then, for 5 days, look at your record.
Oh, that's good. Yeah.
But the next thing to talk about is your audit log. Part of the audit, apart from people, you being informed who's looked at your record in the last however length of time, it starts an audit trail for a break glass,
Okay.
which has to be verified. And there's very strict codes and penalties if you don't adhere to them. So you've had the record for a little bit of time. So with what you've done so far, and going back to the beginning, looking at the shared summary we've done, what do you think? Is it going to help your care?
I think so. I think it'd be beneficial, as you said, when you're visiting multiple practitioners. You don't have to go through everything as much. They'll be able to view a certain amount of what has happened to you. It'd save a little bit of time. But again, if there's an emergency too, all that information's there when it comes time for redoing medications, things like that. Everything's in the one place instead of having to remember everything.
So I've given you a very brief tour of what the PCEHR is, the Personally Controlled Electronic Health Record, for you and I as patients, and we are all patients, and also the people we look after as patients. The most important thing to remember is this is a personally controlled electronic health record. You and I, the patient, has control of the record. We know what's on it. We've approved what's on there. We know who's looking at it, and we have control of this information to help look after our healthcare better. In the case of Jane, you've seen that her care is more joined up because there's information available. But with the shared health summary we've created together, there is even better, good summary information to look after our healthcare now and into the future.